We have a very popular, highly sought after residency program where it's a 3-year program. People join us out of medical school for 3 years. We have 12 residents per year, and this is where we're actually training the future emergency physicians of tomorrow. This is where they get their experience, and as I said, it's a very popular residency program. A lot of people coming out of medical school are seeking careers in emergency medicine. We have fellowships where people, after they finish their residency, come to us for specialty training in things like wilderness medicine, international medicine, ultrasound diagnosis, cardiovascular medicine, disaster medicine, and again, in simulation. Now, just a few words in closing here about the future of the emergency room at Stanford. We are continuously working within our areas of control and influence to improve the whole process. We have almost on a daily basis, meetings between physicians and nurses and all the other care providers in the emergency department, technicians and unit clerks, to try to determine how we can make the process better. So this is continuously ongoing. In 2006, we had a homegrown, internal emergency medicine customer service and patient satisfaction campaign that we launched. We developed it ourselves. We had retreats that we had all of our nurses and all of our physicians and techs and everybody from security personnel to housekeeping came and went through this process. And this is something that we continue to work on a daily basis because, again, everybody that comes to see us is having a bad day. So in our environment, we need to do everything that we possibly can to try to make that experience the best that it can possibly be while they're there, above and beyond making sure we're providing the best possible medical care we can. We continue to do community outreach. These are some of the things that we're involved in. Fall prevention for the elderly, teen alcohol abuse and drunk driving campaigns, things like that we're very actively involved in the community. And then probably, obviously, the biggest thing from what I've been talking about today is our space. And currently, the thing that's most close on the horizon is a renovation we're going to be doing of the emergency room that should begin this fall and will take us about 2 years to do because we're going to have to do it in phases. We're not going to be able to move out of our emergency department and completely renovate and then move back in. We're going to have to close down small pieces of it in a very controlled, phased way and renovate and then move in. And we're doing it in a very thought out fashion so that hopefully we're not going to lose patient care beds during this process. And we hope that at the end of this, it's going to turn out with that new feel like our pediatric area has currently. And then the big news is obviously planning for a future new hospital with a new emergency room. And this is just to show you, I'm not going into this in any detail, you couldn't see it anyway, but this is one of the most recent iterations of the current plan for this new emergency department in the new hospital. And what I want to just show you is I'm going to superimpose on that the current emergency department. And that's it. Okay? So this is what we need. And hopefully by 2015, I'll probably be a patient in it, but I'm really hoping that that's where we are because that's what this community needs. They need the kind of world-class medical care we currently provide, but in an environment that we can't currently provide it in. So, in closing, I'm just going to sum up by saying we're proud to be in your backyard and that we really do want to be here when you need us, not if you need us, because we know, we've seen the show of hands, people need us, and we want to be ready when you come. So, we were going to take questions, but we're not going to take questions yet, so I'm going to hold off on that, Shelley. We'll hold those to the end. Okay?
Thank you so much, Dr. Norris. Hearing Dr. Norris say that the current ED facility opened in 1976 really resonates for me because that happens to be the year I graduated from Stanford, and I know that my class had its 30-year reunion already. So I like to think of myself as young, but on the other hand, I would also like to know that we've had the ability to enhance and improve those services since I graduated from college.